Well, Ghana's COVID-19 case count is ticking up again. The Ghana Medical Association is concerned and is thus urging all to ensure strict adherence to all safety protocols. Before delving into the association's concerns, let's take a quick look at the figures in respect of our current case count. And when you take a look at those cases, you would notice that we have a total of confirmed cases of 134,555 in all, out of which 1,269 have passed on to glory. There also are those who have recovered or discharged, numbering 129,921. The new cases so far, there's a surge in that as well, 321, and the active case count, 3,165. And that is the current picture as far as the COVID-19 statistics are confirmed, with the Greater Accra region still in the lead in terms of the regional log when it comes to the pandemic. Now, the Greater Accra and Greater Kumasi areas are the ones with the most alarming figures so far. This, the Ghana Medical Association attributes to the new Omicron variant. It is thus urging all to report to health facilities for proper diagnosis and treatment while adhering to all preventive protocols. Now, tied to that, let's now bring you details of the GMA's concerns. On PM Express last night with Evans Mensah, President of the GMA, Dr. Frank Sribo, revealed that some of his colleague doctors are getting infected with the new variant. He warns that the threat of infection is so real, Ghanaians must not let down their guards.
We are having a lot of cases in the hospitals at the moment. We have some of our doctors who are testing positive. A lot of the nurses are testing positive. Indeed, there are some wards in some hospitals that are basically now being run by other people from other wards, meaning that all the people in those wards have tested positive and they are supposed to go home. As I speak to you, I am in a very small facility, but I can tell you that 3 of my doctors, we are only 7 doctors, 3 of us have already tested positive. And it's not like they are just asymptomatic, they are symptomatic, and so I have to let them go home.
Are you yourself, does it include you?
Unfortunately, I have not tested because I have not had any symptoms, but they have symptoms as of yesterday.
Okay.
And so we did a test, and as of now, 3 of them are supposed to go home, and they are home, meaning that out of the 7, we have only 4 doctors available to do the work of the 7 people for probably the next 1 week or 2 weeks. And until recently, even our COVID center had been virtually empty. We are beginning to see cases. So the situation in the hospital is not that good. Our colleagues in the testing sites are reporting that now when samples come in, you can predict that about 60 to 80% of the samples will test positive. And so clearly, the situation is not.
He also called for the arrest and prosecution of persons who would flout the protocols during the festive season.
I'm happy that Ghana Health Service has gotten involved to ensure that at least they are meeting event organizers and they are able to be part of their programs and make sure that they're able to regulate and restrict. But just like Kwame said, we can add another layer to it, and that is to do with the antigen testing and, of course, be able to let people prove that indeed they have had their vaccines. After all, that is what Ghana Health Service is advocating for, that for events of such nature, before you go in, you should prove that you are vaccinated. And indeed, with an ID card, not just the vaccination card, because vaccination cards alone does not mean that there is the same person you are looking at. So we need to make sure that those individuals come with national identification cards, and we are able to match the vaccination cards with their ID cards. And beyond that, at least do the antigen test. And after all, when you are coming into the country and you get to the airport, regardless of the number of people who are masked up at the airport, you still have to have an antigen test done, and then your results are declared before you are allowed to enter into the country. And so here, if you choose to go for any program, then you should be ready that when you are going, definitely all the protocols would apply. You have an antigen test done, and you have to prove that you are vaccinated. And once we are able to do that, I believe that it will be more of a double protection for all of us. And I am happy, very happy that Ghana Health Service is getting involved in the events, because if you don't get involved, what you have to do is that then you have to go the brutal way, engaging the security agencies to go and enforce that people are following the right rules and regulations. That is very difficult.
Yeah.
But once you engage them and you are able to regulate it, you are part of the system, and then all of us are advocating at least some level of protection that we can put in place, and add to that the antigen test and, of course, the vaccination. I believe that will be very great and will be very helpful.
Let's also hear from the head of health services promotion at the Ghana Health Service, Dr. Da Costa Abuaje, who also featured on the same show and detailed the outcome of their engagement with event planners in terms of adhering to protocols.
Came up at the meeting, but these are things that we've been doing. For example, if you look at the Youth Connect, we deployed the Greater Accra Regional Team, and they did the antigen test. So, and we told the event organizers that the conversations will continue, is ongoing. So any suggestions that we believe that it will avert any possible surge or any increase in cases, we will let them know. It's a good idea, and we will take it on board to engage further. I mean, I'll be speaking to my Director General and the whole team to see how best we can assist them with the antigen test. But we've done it in the past, and I don't think there is any problem for us to